Om Swastiastu. Hello, doctors and friends. Today, D7 will explain about cholangiocarcinoma. Please enjoy.
Okay, my name is Hara Prabhu Dinasakti with the number of 253 and I will explain about the background of this topic. So, cholangiocarcinoma is classified in multiple subtypes into the intrahepatic, perihilar or distal extrahepatic. Increasing rates has been indicated throughout the last decades and evolving from the known risk factors, with geographical risk factors also as genetic determinants. Identified as the epidemiological trends is in need of high caution with diagnosis, recording, and coding of CCS subtype. Prognosis haven't shown any substantial improvement, with the number of 5-year survival rate is 7 until 20%. Therefore, with this new project in the block Alimentary and Hepatobiliary System and Disorders, we will explain in detail about this incident and other factors involved. The research question for this paper is: what is cholangiocarcinoma? What is the epidemiology of CCA? What is the etiology of CCA? What is the pathophysiology of CCA? What is the risk factors and clinical symptoms of CCA? What is the diagnosis criteria and differential diagnosis of CCA? What is the treatment and management, prognosis and complication of CCA? And the purpose of this research is to develop deeper understanding of CCA, to know the epidemiology of CCA, to understand the etiology of CCA, to understand the pathophysiology of CCA, to understand risk factors and clinical symptoms of CCA, to understand the differential diagnosis of CCA, to understand treatment and management, prognosis and complication of CCA. And the benefit of this paper is, this paper can improve the understanding of medical students in studying the case of CCA, covering definition, epidemiology, etiology, pathophysiology, risk factors and clinical symptoms, diagnosis criteria and differential diagnosis, treatment and management, prognosis, and complication of CCA. This knowledge can later be applied as a handbook of medical student knowledge in dealing with and handling similar cases in the future. Thank you.
Hello, my name is Putri Indria and my last row number is 200, and I'm going to talk about the definition and epidemiology of cholangiocarcinoma. The first is definition. Definition of cholangiocarcinoma is a type of malignant tumor that is found in the biliary ducts, and in the society, this type of malignancy can also be identified as bile duct cancer. Based on its anatomical position, bile duct cancer or cholangiocarcinoma can be classified into three types. The first is intrahepatic cholangiocarcinoma, second is perihilar cholangiocarcinoma, and third is distal cholangiocarcinoma. That is all about the definition that we need to know. Moving on to the second topic is epidemiology. Just like other diseases, cholangiocarcinoma's prevalence is also different from each region of the world. For example, in America, the mortality rates and prevalence for cholangiocarcinoma is 1.3 out of 100,000, and in Asia, it's 1.4 over 100,000, and in Europe, it's 0.8 over 100,000, and lastly, in Africa, is 0.7 over 100,000. For each type of cholangiocarcinoma is also different. For example, in most cases, out of 100%, 50% of the cases is perihilar cholangiocarcinoma, and continued by distal cholangiocarcinoma at 40%, and the rest is intrahepatic cholangiocarcinoma. That's all about the definition and epidemiology. Thank you.
Good morning, Dr. and friends. My name is Putu Andrea Wissus Bastian. It's the number 143. So I'm going to explain about the etiology of cholangiocarcinoma, or we can call it CCA. So CCA is a multifactorial disease that can cause by, first is the pancreaticobiliary maljunction, or PBM. This will cause the regurgitation and integration of bile and pancreatic products that cause the cut of the extrahepatic bile duct and gallbladder. This will inducing the metaplasia of the bile duct and or the gallbladder that will leading to carcinogenic development. The second is the genetic alteration of CRAS and P53 overproduction that will lead to intraepithelial biliary neoplasia. The third is the epigenetic quietness of cytokine signaling 3 or COX-3 that will cause overexpression of MCL1 that will lead to CCA development. Another like metabolic disorder and parasite infection can be the etiologic agent of CCA.
Hello, doctors and friends. My name is Zaki Arafi ID with shoe number 122. So today I will explain about pathophysiology of cholangiocarcinoma. Cholangiocarcinoma is an epithelial malignancy originating from transformed cholangiocytes and hepatic progenitor cells. Inflammation and cholestasis are key factors in cholangiocarcinogenesis. Pro-inflammatory cytokines such as interleukin-6 activate inducible nitric oxide synthase, resulting in excess nitric oxide that cause oxidative DNA damage, inhibition of DNA repair enzymes, and expression of cyclooxygenase 2. Pro-inflammatory pathways downregulate hepatobiliary transporters, which in turn contribute to cholestasis. Bile acids and oxysterol activate epidermal growth factor receptor (EGFR) and enhance cyclooxygenase 2 expression. Cyclooxygenase 2 dysregulate cholangiocarcinoma growth and apoptosis resistance, and increase the regulation of pro-oncogenic signaling pathways such as hepatocyte, growth factor, interleukin-6, and EGFR. That's it for today. Thank you.
Hello, my name is Udayana with student number 239. Now I will explain about the clinical symptoms of cholangiocarcinoma. The clinical symptoms of cholangiocarcinoma are non-specific. To diagnose it requires several combined interpretations. In patients with intrahepatic cholangiocarcinoma, it usually becomes symptomatic at an advanced stage of disease with non-specific symptoms such as dull pain in the right upper quadrant, weight loss, abdominal pain, malaise, night sweats, and cachexia. In peripheral cholangiocarcinoma, often cause obstruction of the bile ducts with symptoms such as jaundice, weight loss, abdominal pain, fever, and pruritus. Jaundice is a symptom that appears in 90% of patients with peripheral cholangiocarcinoma and acute cholangitis in 10%. 50% of patients with peripheral cholangiocarcinoma have signs of symptomatic malignancy such as anorexia, weight loss, and fatigue. A palpable protrusion of one lobe of the liver may sometimes be noted as manifestation of a hypertrophic complex. That's all about my explanation. Thank you.
Hello, my name is Dere Cynthia Augustine with my student number 069, and I would give explanation about the risk factors of cholangiocarcinoma. So, cholangiocarcinoma is a multifactorial disease that caused by a complex interaction between host-specific genetic background and multiple risk factors. Some of the risk factors are less frequent but associated with higher risk, whereas others are more common but associated with lower risk of cholangiocarcinoma. Some of the risk factors seem to be more specific for intrahepatic cholangiocarcinoma or extrahepatic cholangiocarcinoma, but some of them also can cause both intrahepatic or extrahepatic cholangiocarcinoma. All risk factors can cause cholangiocarcinoma is primarily linked to chronic inflammation and increased cell proliferation of biliary epithelium cell. Chronic inflammation itself can lead to cell proliferation by affecting genetic alterations such as shortening of telomeres and inactivation of p53 tumor suppressor gene, which can cause chromosomal instability and predisposition to malignant transformation. Another processes also contributing to induced cholangiocarcinoma are increased production of mutagen substances, fibrosis formation or fibrinogenesis, lipid peroxidation, hyperinsulinemia, microbiome dysbiosis, direct carcinogenic effect, or even indirect effect that mediated by other intermediate risk factors. Maybe that's all that I can say about the risk factors of cholangiocarcinoma. Thank you.
Hi everyone, my name is Daniel Somota Masirudinmo, student number 045, and I'm going to explain about the diagnosis of cholangiocarcinoma. For the clinical features, the most common symptom of cholangiocarcinoma are malaise and weight loss. The other symptom would be jaundice, dark urine, and pale stools. Laboratory findings that we can find are cholelastic injury with alkaline phosphatase higher than twice normal, increased gamma glutamate transferase, and high bilirubin. Best diagnostic tools for diagnosing cholangiocarcinoma is MRCP or magnetic resonance cholangiopancreatography with specificity 75 to 85%. This specificity can be increased by 10% with contrast-enhanced study. However, contrast-enhanced study is contraindicated in patients with renal failure. Invasive evaluation and tissue sampling should be done if there are findings of mass, ductal dilation, structure, contrast enhancement, ductal wall thickening, or irregularity. Thank you.
Hello, my name is Nanda Pramesti with student number 167. Now, I'm explaining about differential diagnosis for cholangiocarcinoma. The first is combined hepatocellular cholangiocarcinoma or CHC. According to hypothesis by WHO, CHC is derived from liver progenitor cell. However, to date, there has been no evidence reporting a different component of CHC. Because of this, WHO classified CHC into classic subtype and stem cell subtype. The second is hepatocellular cholangiocarcinoma. The structural form of HCC is a pseudoglandular pattern, while intrahepatic cholangiocarcinoma is a trabecular pattern. This is a very difficult to differentiate, the only difference being for HCC to have a prominent nucleolus and show pseudoglands or mucin. The third is Kirchhoff's HCC. Judging from the microscopic structure, it is characterized by a subscapular mass of white, dry, fibrotic, and dense, well-defined, non-encapsulated, whereas for its microscopic structure, there is a fibrous band that extends along the blood chamber, shaped like a sinusoid mixed with trabecular of tumor cell. Thank you.
Hello everyone, my name is Turjan Skotasi with the last 3 digits to number 021. So I'm going to explain about how to prevent cholangiocarcinoma. Although there is no proven way in preventing this disease completely, there are several ways to lower the risk of cholangiocarcinoma. Following a healthy diet and getting regular exercise can lower the risk of bile and other types of cancers. And other way that people could do in order to prevent cholangiocarcinoma include vaccinated against bloodborne or sexually transmitted disease like hepatitis B and hepatitis C to prevent liver cirrhosis, avoid drinking alcohol, quit smoking, avoid certain chemical like thorium dioxide that was used in X-ray examination. This hazardous chemical is believed could increase the risk in developing bile cancer. And the last one is consume food that have been cooked truly. In Southeast Asia, bile cancer is often found in people who consume raw and undercooked fish or sea plants. Early detection is also another important part in preventing cholangiocarcinoma. In Thailand, Thai Ministry of Public Health also has begun using plasma interleukin-6 screening in areas where infection with the Opisthorhis viperini or liver fluke are common in order to detect the liver cancer. Thank you.
Hello, my name is Pratista and my student number is 227. So now I'm going to explain about the treatment and management of cholangiocarcinoma. Cholangiocarcinoma or CCA is one of the rare cancers, so these treatment and managements have so far only been evaluated in small studies. Some of the treatment that can be done in CCA patients such as the first one is surgery. Resectable CCA can be treated by surgery and it is the curative treatment option for CCA. The second is adjuvant therapy. Adjuvant therapy such as radiotherapy, chemotherapy or combined treatment is believed to relieve symptoms and improve overall quality of life of the patient. The third one is advanced treatment for unresectable and metastatic CCA. Chemotherapy remains the basis of standard treatment for inoperable metastatic or recurrent disease with several classes of active cytotoxic agents including gemcitabine, platinum compounds, and fluoropyrimidines. The fourth one is systemic therapy. Systemic therapy is the mainstay of palliative treatment for patients with advanced or recurrent CCA. The standard of treatment or first-line treatment of CCA is cisplatin or gemcitabine combination.
Hello, my name is Shantika with my student number 106. Here, I'm going to explain the prognosis and complications of cholangiocarcinoma. However, prognosis that patients have after getting diagnosed depends upon many factors, such as cancer location, spreading, stage of the cancer, timeline, complications, and the last one is tumor marker. Generally, the dismal prognosis of cholangiocarcinoma owes to its silent clinical character, difficulties in early diagnosis, and limited therapeutic approach. However, staging systems can guide the stratification and provide prognostic information. Principally, it's made based on tumor location and spreading, with the prognosis as follows. The first one is local stage, means tumor is located only within the bile duct and can be removed surgically. Evidence of spread to areas outside the bile duct is not found. So the second one is locally advanced stage, means tumor is located only in the area around the bile duct. However, it affects nearby organs, arteries, or veins. Evidence of spread to distant parts is not found. And the last one is metastatic stage, means tumor spreads beyond the area of the bile duct and reach distant parts of the body. Surgical management cannot remove all of the cancer. There's also 5-year relative survival rate within the specific stage of the bile duct cancer. It shows that patients with perihelial extrahepatic tumor that are completely resected may achieve long-term survival, as well as patients with distal extrahepatic tumor may have the best hope for survival if tumors are excised completely, because tumors at the site are the most likely to be resectable. Meanwhile, prognosis is poorest for the patients with intrahepatic tumors. For the complications of cholangiocarcinoma, basically based on spreading and differentiation of the cancer itself.
Hello everybody, my name is Manigandan and the last 3 digits of my name is 249. Today I'll be talking about the last part of the presentation, which is the conclusion. Cholangiocarcinoma is a rare malignant tumor that originates from the epithelial cell and the bile duct system. While only surgical resection can provide a cure, most of cholangiocarcinoma are detected at an inoperable stage and associated with poor prognosis. Moreover, cholangiocarcinoma has high recurrent rate and even after curative surgery. Adjuvant chemotherapy is effective in patients with cholangiocarcinoma after curative surgery, especially with lymph node positive and resection margin positive disease. Thank you, and that's all for today.
That's all from our presentation. Thank you for your attention, and we close it with Paramasanti. Om Santi Santi Santi.